Hi, in this video, I will try to give you some tips against the nagging problem of nausea and vomiting in pregnancy. This morning sickness, the nausea and vomiting of pregnancy, why does it happen? Actually, it's very interesting. It is a sort of a protective mechanism to the baby inside. The mother's body understands that it is carrying a very precious treasure inside. So, anything which is coming from outside which can affect this baby, which can be toxic to this baby, it will try to eject it out, vomit it out. Now, so any case, the pregnancies which are actually affected by a lot of nausea and even vomiting have often a very successful outcome. Now, scientists have seen that the level of HCG, the pregnancy hormone, often leads to this vomiting problem. The higher the HCG level, the more chance of vomiting. Where do you get very high level of HCG? In cases of twins, in cases of a condition called hydatidiform mole. In these conditions, the vomiting is much higher and it can lead to hyperemesis, which means excessive vomiting. I will discuss about hyperemesis sometimes later. Now, here I'll give you some tips about how to get some relief from this nausea and vomiting. Normally, this nausea and vomiting usually improves once you go into the second trimester. But in some cases, I have seen this have continued to the end of the pregnancy. And one extreme case I remember where the pregnancy was terminated to get some relief, give some relief to the mother so that she was suffering from excessive vomiting and she couldn't tolerate anymore and she was getting dehydrated, electrolyte imbalance was happening. Now, one of the tips is that there are very good medicines, like one medicine which is commonly used is called doxylamine, and this can be taken very late at night at bedtime to prevent the morning sickness, the nausea which happens in the morning. Before you brush in the morning, just take some solid food like some biscuits and then put the brush in your mouth, because if it touches the back of your throat, you will feel very nauseated and you may start vomiting in empty stomach. Most important is that avoid all sorts of aromas, scents, perfumes, and things. Like avoid going close to the kitchen, to the toilet, and maybe deos and perfumes and soaps, etc., can cause immense amount of nausea. Most importantly, this mysterious condition, as I said, this I have seen more prevalent when I was in England. I've seen it more prevalent among the Asian population. It was much less among the indigenous white population. And so some genetic factors, some racial factors work here. Some psychological things can work here along with the hormonal changes. So environment, like if you change the environment, I tell my patients who are suffering too much from this nausea, vomiting, and say that change your environment. Stay for 2 days in a home. If you have another option, if the vomiting starts coming back, go to another environment, go to somebody in-laws house or your parents house, and it will improve. Interestingly, when with hyperemesis, when they are having excessive vomiting, we admit the patient immediately. Within 24 hours the patient becomes well, completely recovered. But as soon as she goes home, within 24 hours, again this condition restarts. So changing of environment is very important. Sometimes I tell people to go for a vacation, go for some trip, and it helps. The special case I was telling you where they had to terminate the pregnancy, I got one of the pregnancies, that the next one, they came to me for the next pregnancy, and I told them to go for a trip to Darjeeling, to the hills, and they improved, and I continued the pregnancy till term, and then I delivered. So this is a very interesting condition, very nagging condition, frustrating condition. But again, as I said, the positive factor is that those who suffer from a lot of nausea and vomiting, the pregnancy is often very, very successful. To know more of these topics, please subscribe my channel. If you want to know more, please write in the comments so that I can post these videos for you. Thank you.